Good day, ladies and gentlemen. Trust the day is going well. So, welcome to Head to Clock series. Alright. So, today's topic is going to be about travelers' diarrhea. We all know that diarrhea is a watery stool that an individual or someone passes out from the anus. So, one will be like, okay, what's travelers' diarrhea? Alright, calm down. So, traveler's diarrhea is when someone is traveling to a new environment or to a new place, maybe for picnic or for recreation activities, and they get to know to that environment, maybe for a camp, and that environment is not conducive enough, it's not hygienic, and bacteria from the surface or any places can make their way into their food or their water, and it becomes what contaminated. So thereabout they begin to have stomach pains and start stooling. So that is to say that sometimes this traveler's diarrhea, when someone travels to a new place, it's kind of like, you are becoming ill, you're becoming sick and all, and stooling. That's just the basic symptoms of what traveler's diarrhea. And traveler's diarrhea is really happens for those people that like to travel. Travelers gang, where are you? So my people, so that travels a lot, so it happens once in a while, but it's not really serious. It's not really a serious thing, but at one point in time it could be serious. Now let's look at one prevention of this travelers diarrhea. Okay, this travelers diarrhea, we need to avoid it in a way whereby if we travel, make sure your cups, the environment you are going to stay is hygienic. You should note that food you are not used to, please don't eat it. Not when they are doing food you've not mastered, or you go to a new environment, you want to eat food that you've not eaten when you've been growing up, and you want to test it, or did they have poor hygienic area where they did that food and you start stooling. Some persons may react to the food in that places because of the water being used is not properly clean, or the environment. So that is it for the environment section. Another factor we'll look at is that to avoid it, you need to, if you are traveling, please have your own plates, cups and spoon that you use to eat, to avoid the other setting of whereby maybe their cutleries and everything is quite dirty, and the water in particular. So traveling could be fun, but it could be unpleasant when you start stooling on the way with all those food intake. So reduce your food intake over there or in that environment in court. If you notice that environment is not properly hygienic, just mind the kind of foods you buy in that place, so that you will not be running 440 in the vehicle. So that, of course, is what we should just avoid. Now, let's look at one good thing about this, not really a good thing about this traveler's diarrhea. It could happen for 1 to 2 days. That is normal, quite normal. It's going to happen. The scenario whereby it's someone who can stool. But one thing is very important. Please take note. If you are traveling, always learn to carry a doctor prescribed medications that would stop stooling, which is flagyl, popularly known as flagyl. Flagyl is a very good medication, as if you are traveling from one location to another, please get that in short, it should be your best friend. So that is it. It should be your best friend, because it's not really a good scenario by you start having running stomach in a vehicle. It's not really a good thing. So flagyl should be your best friend at one point in time. Get those medications that stop stomach aches if you are the type that easily react to them. But when it becomes severe, like more than 1 to 2 days, please go to the hospital for what checkup. It's really important for you to go to the hospital for checkup in order to be well fitted, and maybe there could be another disease related to it. So one factors you can consider that causes this travelers diarrhea is one, abdominal pain, maybe fever, vomiting, and maybe retinal pain as well. Why I talk retinal pain, that means you're feeling pain from your anus and all. So we should all just try to, if you are feeling this kind of pain, just know that it's a traveler's diarrhea, that maybe you left a community to another community and you have this pain. It's quite okay for the symptoms, but after the symptoms, but if the symptom persists, that means it is what dicey. You need to go to the hospital and check yourself properly if there's another side attachment of what this is it. So basically, this traveler disease is more hygienic. Please out there, followers out there, be what hygienic. Don't go to the toilet without washing your hands. Don't come out from that toilet without washing your hands. It is improper, please. It is improper. Always use soap and water to wash your hands. Even in your house, do it. It is improper. Those things are not there for fancy at all. So thank you. Till next week, Friday. See us on a new topic. Take care.